Guru Nation, how's it going? I just did a podcast. I wrapped up a podcast with Darshan Kulkarni, one of the best friends of the pod, and we talked about AI, artificial intelligence, and how that is definitely going to change not just clinical research, but every industry in the space. And it got me thinking about how do we remain resilient in the face of so much change. And one of the things that we got to keep in mind is that life is a process of changes. Some happen quicker than others, but you being alive and eventually being dead is a process of change. Like, we are used to change. We are built for dealing with change. And in our careers, it's no different. We should never get stagnant in our skill sets. We should never get too comfortable with where we are. Even me as a content creator, you would think, oh, well, AI is never going to replace Dan. My videographer, Daniel, showed me an AI voice of me, and he put it in the video, and you can't even tell. I couldn't even tell it wasn't me until he told me that it wasn't me. And so, of course, everything is up for change. Everything is up for disruption. But what can you do as somebody who works in this space? Number one, you got to increase your skill set. So start playing with some of these tools. If you're not on ChatGPT, if you're not on Gemini from Google, if you're not on Grok on X, I mean, you should start playing around with these things. Some of them are free. I think ChatGPT has a free version. I think Gemini does. You need to learn these things. Did you know that you can see how easily source documents can be created with AI? I've tried it out at my site. I did a video with Luis. Now, you should have adult supervision and have a human being who knows the protocol look at the source after, because AI can make mistakes. I found AI making tons of mistakes on simple things I ask it to do, but with corrections, it gets 90% of the task accomplished, and for free or for very cheap. So if you're someone that works in the space, the first thing you got to do, besides recognizing that things will change and don't be stubborn and hold on to the past, is embrace the tools. The tools are coming. The tools are already here. Embrace them. Start figuring out ways to use them in your job. Make sure you're allowed to do that, because there's laws here, and Darshan will be the first one to tell you no. But figure it out. There's no law preventing you from learning how these things work and how they can impact your role, and then how could they possibly make your role easier. So figure out how to do that. Figure out how to embrace these tools. Start playing with them. Then start looking at pain points of companies in the industry and really start networking at the same time. So go on LinkedIn, go to conferences like SOS, go to meetups like ACRP, Latinos in Clinical Research, whatever. I don't care which ones you go to, just go. Listen to the different stakeholders. There's research sites, there's CROs, there's sponsors, there's big sponsors, there's small sponsors, there's mid-sized sponsors, there's big site networks, there's small sites, there's medium-sized sites, there's tech vendors, there's all kinds of people in this space. All of them have problems. Figure out what their pain points are, and then figure out where your skill sets and where your inclinations are of what the skills you've already amassed. It's not a waste of your time. You can now use that as a foundation to build the next series of solutions. And I don't care if you're not an entrepreneur. You can still build solutions and be an asset for an organization in your existing company, or if you're out of a job at a company. Or maybe if you want to try going out on your own as a consultant or as a contractor, which is kind of in between an employee and a consultant, or as a business owner yourself. This is the way to do it, is recognize what's happening. Don't stick your head in the sand like an ostrich and ignore the trends. Play around with the trends. Build upon your existing skill set. Learn what inclinations you already have, what things you're good at, and what the market needs, and then network from the pain points that all these stakeholders have, because there are tons and it's dynamic and this stuff is just starting out. So that's how you remain resilient in this day and age with AI just in all of our faces. And let's see what's hype and what's here to stay. But this is definitely a paradigm shift, and it's going to be happening in every industry. And I want you to be prepared and ahead of the curve rather than getting caught behind. And one of the benefits of being in such a slow to adapt industry like clinical research, one of the most highly regulated industries, the changes in our industry happen pretty slow. So you'll be able to see other industries getting radically disrupted before you see our industry get radically disrupted. So start paying attention, not just to this industry, but to other industries. See what's going on, what's happening in finance, what's happening in agriculture, what's happening in retail. Just start paying attention. Google agentic AI and just study that for a second and see what in your role. Do an honest audit. Ask ChatGPT. This is my role. Do an honest audit of places within my job responsibilities that artificial intelligence can replace. And then how does this relate to agentic AI? Start playing around with it. Like, subscribe, comment, share. Of course, keep subscribed because we're going to bring you the info as soon as we have opinions on it and as soon as we know what's going on. Myself, any guest I bring on, maybe you one day. Bye-bye.